let's talk about what other countries are doing, because at some point, I feel like people who are willfully unvaccinated, fine, don't get vaccinated. But they need to start to pay a little bit more of the cost of what this is doing to our system. There are fines that are levied in places like Germany. Germany has stopped paying for the tests, the virus tests for people who choose to be unvaccinated. They've ended quarantine pay for those without vaccinations. IKEA, the company, is slashing sick pay for unvaccinated UK workers. If you are a smoker, insurance companies can charge you more. They can charge you a premium up to 50%, and you have to put that on the form when you apply for insurance. At some point, don't we have to make people who are just saying, I'm willing to take the risk to be unvaccinated, take the risk for me and take the risk for everyone I come in contact with? Shouldn't they have to pay more into the system because they are collapsing our health system? They're the ones in the ERs. They're taking it up. If you have a stroke or you have a heart attack, you can't get in the ER because they're taking up all the beds. So shouldn't they have to pay more?
Hello, everyone, and welcome to the Gregory Wright Show. My name's Gregory Wright, and thanks for watching. Hey, I just want to get into this real quick. I need to ask a question. Why is Joy Reid so damn mad? Did somebody take her lunch or something out of the refrigerator at work? Is she hungry? Come on, man. That last video was ridiculous. Just straight up ridiculous. And she made more than a few points that I would like to address real quick before we move on. She seems so concerned about what other countries are doing, and I'll get to that after this segment. I will show you exactly what other countries are doing, and it is to the contrary to what she recommended, okay? She brings up the point about smokers paying a high premium on insurance papers and insurance contracts, okay? Yes, smokers do pay a higher premium, but let's dissect that a little bit. The government isn't imposing cigarettes on the public, nor is the government mandating non-smoker status. All right. She failed to bring up obese people. Overly obese people have heart problems, kidney problems, and things of that sort. They're taking up hospital beds as well. They take up 2 seats in the airline. Should they pay for 2 seats in the airline? They damn sure should pay a higher premium, just like smokers. Again, the government isn't imposing junk food on its citizens. It's not mandating junk food on its citizens, nor is the government mandating non-obese status in America. Okay, two items grouped in the same basket, but they're vastly different from this COVID-19 situation. Okay, COVID-19 came out of nowhere, and it infected hundreds of thousands of people, killed hundreds of thousands of people, and the United States got into an emergency posture to slow the spread. Okay, 15 days to slow the spread. That didn't work. Wearing masks, social distancing, that didn't work. Vaccines, vaccine mandates. The president himself told us that when you get the vaccine, you cannot get the virus and you cannot spread the virus. None of that is true. Okay? So she mentions the risk of being unvaccinated. Well, what is that risk? What does she mean by that? Does she mean that the unvaccinated can only spread or contract the virus and spread it to others? Well, I have news for you. Vaccinated people can contract the virus and spread the virus just like unvaccinated people can as well. Okay? The only benefit to being vaccinated is that people who are vaccinated, for the most part, manage to avoid severe illness, hospitalization, and death. That is it. Okay? And for unvaccinated people who have natural immunity, can also avoid severe illness, hospitalization, and death. And let me mention one other thing about vaccinations, COVID-19 vaccinations. You almost hear nothing about vaccine injuries. They sweep that under the rug. And so keep that in mind. And lastly, we're going to get into what other countries are doing, which is contrary to what Miss Joy Reid is talking about. Let's kick it.
This morning, the Cabinet concluded that because of the extraordinary booster campaign, together with the way the public have responded to the Plan B measures, we can return to Plan A in England and allow Plan B regulations to expire. As a result, from the start of Thursday next week, mandatory certification will end. Organisations can, of course, choose to use the NHS COVID pass voluntarily, but we will end the compulsory use of COVID status certification in England. From now on, the government is no longer asking people to work from home. And people should now speak to their employers about arrangements for returning to the office. And having looked at the data carefully, the Cabinet concluded that once regulations lapse, the government will no longer mandate the wearing of face masks anywhere. Mr. Speaker, Mr. Speaker, from tomorrow we will no longer require face masks in classrooms, and the Department for Education will shortly remove national guidance on their use in communal areas. In the country at large, we will continue to suggest the use of face coverings in enclosed or crowded spaces, particularly when you come into contact with people you don't normally meet, but we will trust the judgment of the British people and no longer criminalise anyone who chooses not to wear one. The government will also ease restrictions further on visits to care homes, and my right honourable friend, the Secretary of State for Health and Social Care, will set out plans in the coming days. Mr. Speaker, as we return to Plan A, the House will know that some measures still remain, including those on self-isolation. In particular, it is still a legal requirement for those who have tested positive for COVID to self-isolate. On Monday, we reduced the isolation period to 5 full days with 2 negative tests, and there will soon come a time when we can remove the legal requirement to self-isolate altogether, just as we don't place legal obligations on people to isolate if they have flu. As COVID becomes endemic, we will need to replace legal requirements with advice and guidance, urging people with the virus to be careful and considerate of others. The self-isolation regulations expire on the 24th of March, at which point I very much expect not to renew them. Indeed, were the data to allow, I would like to seek a vote in this House to bring that date forward.
Well, thank you everybody for coming here this afternoon. Today, more than 2.3 million COVID-19 vaccinations have been administered in Saskatchewan. It has gotten us to a point where those 12 and over, we have an 85% fully vaccinated rate. Our entire population is 75% fully vaccinated rate. We have 48% of those 12 and over have their booster shot. That's among the highest in Canada, and likely even more impactful than that is of our Saskatchewan residents aged 60 and over, 75% of them have went out and gotten their booster shot. It puts us in a strong position as we find our way through the Omicron wave. This is good news, as vaccines do reduce the likelihood that people would experience severe outcomes due to COVID. And it's good news because Saskatchewan people have consciously made the choice to go out and get vaccinated in large numbers. Saskatchewan has never had a vaccination mandate per se, but we have had the proof of vaccination or the proof of the negative test requirement in place since the Delta wave that we experienced last fall. This difference from the federal vaccine mandate that is you either get vaccinated or you ultimately lose your job. The requirement that we had in Saskatchewan with the proof of vaccination or the option for the proof of negative test had two goals. One was to convince additional people to go out to make it a priority and go out and get vaccinated. And two was to reduce transmission of COVID. And I would say that it's been very effective on both counts, in particular as with the Delta variant. But now, in light of the Omicron wave that we're facing, it is incumbent for us to adapt, as it's quite obvious that the virus itself has adapted. Omicron transmits among vaccinated and unvaccinated individuals quite freely. Over the past week, for example, we've had 78% of our new cases were in those folks who were fully vaccinated. Many of them have also received their booster dose. I would be an example of that. I received 3 doses. I contracted the Omicron variant. We see today that the Prime Minister, also an individual with 3 doses, has contracted the Omicron variant. So 78% of new cases over the course of the past week were in individuals that would be considered fully vaccinated. As I said earlier, 75% of our population is fully vaccinated. The bottom line of all of this is that vaccines do work, but they are no longer working at preventing transmission in this wave of COVID-19 like they previously did in the Delta wave, at which they were quite effective. And that is why the proof of vaccination or the proof of negative test requirement that we have in Saskatchewan will very soon come to an end. Public health experts, including our Chief Medical Health Officer, Dr. Shahab, has signaled that Saskatchewan is near the peak of the Omicron wave and that we will see the pressure reduced on our healthcare system in the weeks to come. Day in and day out, for almost 2 years now, Saskatchewan people have done what we and health professionals have asked them to do. They have followed all of the public health measures when they are implemented and when they have been necessary. They have gone out and gotten vaccinated. 75% of our entire population, 85% of those that are eligible have went out and gotten vaccinated. They are utilizing rapid tests, and I would say that in Saskatchewan we are utilizing the supply of rapid tests that we have unlike anywhere else in Canada, and that is a good thing. Saskatchewan people are also aware of and they are utilizing, when it is necessary, any early intervention treatments such as monoclonal antibodies, such as ultimately Paxlovid, that is now available and being administered here now in the province. So now, and our caucus MLAs are hearing this from the people that they are talking to across the province and the people that they ultimately represent, and people are asking their government for a return to normal, a removal of public health restrictions, and we most certainly are looking at how we can do that in the weeks ahead here in Saskatchewan. And now I think it is, in fairness, it is time for us as a government to do what Saskatchewan people are asking for. Public health will have more to say on how we are going to continue our steps towards living with COVID in the days ahead. As I understand, they will make themselves available later this week. But now I would take any questions if there are any.
Fra den 1. februar om ganske få dage, så vil Danmark igen være åbent. Helt åbent. Det markerer en overgang til en ny tid for os alle sammen. Under pandemien, der har vores tålmodighed og vores udholdenhed og vores sammenhold som danskere, der har den været testet. Og i dag, der kan vi sige, at vi bestod. Vi er klar til at træde ud af coronaens skygge. Vi siger farvel til restriktionerne og velkommen til det liv, vi kendte før corona. Pandemien er her stadig. Men med det, vi ved nu, så tør vi, der står her, tro på, at vi er igennem den kritiske fase.
See, Joy Reid, that is what other countries are doing around the world. And I hope that other countries, including the United States and the rest of Canada, follow suit, because we are tired of being dictated on what to do, what not to do. And we are tired of you, Joy Reid, perpetuating us against them, vaccinated against the unvaccinated, fear mongering. I don't like it. Please use your platform for the greater good. Why don't you criticize Joe Biden's withdrawal from Afghanistan? Why don't you use your platform to heal America, bring Americans together instead of what you're doing here? If you like the content of this video, please share, like, and subscribe. Hit the notification bell so you can get all the new updates on the new videos that I post. Thank you for watching.